The Differentiation of Warm Diseases, authored by the Qing dynasty physician Wu Tang. Chapter 2, Upper Burner Section. Sections 11 to 15. 11. In cases of warm diseases of the greater yin, tai yin, if bleeding occurs from the upper orifices, treat using the combination of Shijiao de Huang Tang, rhinoceros horn and Rihania decoction, along with Yinqiao San, honeysuckle and forsythia powder. If there are symptoms of middle burner affliction, employ treatments appropriate for the middle burner. If a patient vomits pink-colored blood, this indicates a serious condition that is difficult to treat. When blood overflows from the upper, and the pulse beats 7 to 8 times or more, and the facial color turns black, this signifies a severe situation that is hard to remedy. The method of clearing collaterals and nurturing yin should be adopted. When blood spills from above, the warm pathogenic factors forcefully push, and the blood flows upwards along the clear pathway, passing through the clear orifices and being discharged. Therefore, Yinqiao San is used to break down the warm toxic pathogen, and Shijiao de Huang is used to cleanse the blood, differentiate and suppress the lurking heat, thus saving the body fluids, similar to rescuing precious metal. As for the profuse red waters, it is neither blood nor liquid, but a convergence of substantial blood and fluid, possessing an overwhelming momentum, surging continuously. When blood spills from above, the pulse reaches 7 to 8 beats or more, and the complexion turns black, indicating an extremely intense fire condition that paradoxically resembles water, reflecting a highly critical state of the illness, where the interplay between fire and water exacerbates the condition. Such a situation cannot be controlled, while simultaneously the lower burners jinyi, body fluids, are severely deficient, failing to ascend the nourishing fire of the heart, instead intertwining with the warm pathogenic factors, making it difficult for the metal of the lungs to endure. Therefore, it mainly presents as a state close to death, termed as the first fatal pattern of warm diseases. Confucius, in Zhongzi Wen, asked about death, to which he answered, "Not knowing life, how can we know death?" This implies that if a physician cannot comprehend death, how can they rescue lives? In summary, the patterns of death in warm diseases can generally be categorized into 5 rules. In the upper burner, there are 2 situations: one is death resulting from lung pathology, and the other is death due to internal closure of the heart spirit or external dissociation of it. In the middle burner, there are 2 situations: one is death caused by Yangming large intestine's excessive heat controlling the fluids, and the other is death caused by spleen depression turning yellow, severe jaundice leading to the blockage of various orifices, and the obstruction of passageways by turbidity leading to death. In the lower burner, it is mostly due to the penetration of heat evils, consuming and exhausting the essence and seminal fluid, resulting in death. 12. For cases of warm diseases of the greater yin, in the presence of severe thirst, one can consume pear juice to alleviate the condition. If there is discomfort accompanied by the expulsion of white sticky mucus, one can opt for the 5-juice drink to alleviate the symptoms. These methods fall under the category of sweet-tasting medicinals, capable of nurturing bodily fluids. When preparing pear juice, it can be combined with juices from water chestnut, fresh reed root, Ophiopagon japonicus, lotus root, or sugarcane, according to the specific situation. After thorough mixing, the concoction is consumed as a cold beverage. If a preference against cold exists, the mixture can be heated and consumed as a warm soup. 13. In the initial 2 to 3 days of greater yin illness, the tongue slightly turns yellow, the pulse at the wrist is forceful, there's a restlessness of the heart-mind, discomfort prevails when both standing and lying down, a desire to vomit but inability to do so, and the absence of middle burner symptoms. In such cases, jizi kai tang, gardenia and fermented soybean soup can be utilized for treatment. As for greater yin illness after 2 to 3 days, if the tongue slightly turns yellow, the pulse remains forceful, the heart-mind is agitated, there's restlessness when both standing and lying down, and a desire to vomit but inability to do so, it signifies that pathogenic influences have reached the chest region of the upper burner. In upper burner conditions, the pathogenic influences gradually disperse. Therefore, jizi kai tang is used to induce vomiting of pathogenic influences, while huajia kai tang, fermented soybean and gardenia soup, is employed to break up the pathogenic influences, achieving the effect of relieving the surface. The preparation of jizi kai tang involves the use of sour and bitter medicinals. 5 crushed gardenia fruits are combined with 6 qian, a traditional Chinese unit of weight, of fermented soybeans and 4 cups of water. Boil the gardenia fruits several times until boiling, then add the fermented soybeans, and continue boiling until 1 cup of liquid is obtained. Consume a warm cup initially and again after vomiting subsides. 14. In the initial 2 to 3 days of greater yin illness, when experiencing restlessness, excessive phlegm and saliva accumulation, a sensation of blockage and discomfort in the chest, along with nausea and an inclination to vomit, and without middle burner symptoms, Gua Di San, melon pedicle powder, can be used for treatment. If it's a case of weakness, Sang Lu, Morris leaf, can be added. This differs in severity from the previous section and is also related to the presence of phlegm and saliva. Medicinals with higher doses should not be used casually, as mild usage of medications in severe cases might not be sufficient to resolve the issue. Therefore, the previous section utilizes only Jizi Kaitang to rapidly induce vomiting of the pathogenic heat within the chest. Due to the pronounced accumulation of phlegm and saliva, swift use of Gua Di San is needed to induce rapid vomiting, to prevent the pathogenic influences from entering the diaphragm and causing spasm or counterflow. Gua Di, melon pedicle, and Jizi, gardenia, possess a bitter-cold nature, combined with the sweet-sour nature of Kai Xiaodo, red bean. The concept of sour-bitter purging and draining has a yin-releasing effect, making it highly suitable for cases adept at vomiting heat phlegm. It's also an example of the treatment principle, move out what's above to treat. Gua Di San formula is a sour-bitter prescription. Sweet melon pedicles are used at a dosage of 2 qian. Red beans are used at a dosage of 2 qian, both ground, and Shan Jizi, gardenia jasminoides, is used at a dosage of 2 qian. Boil with 2 cups of water to obtain 1 cup of decoction. Initially, consume half a cup and continue after vomiting stops. If vomiting doesn't occur, it can be consumed again. In weakened conditions, Sang Lu can be added at a dosage of 1 qian and 5 fen. 15. In cases of greater yin warm diseases, where the pulse at the wrist is wiry, large, and forceful, the tongue appears purplish and dry. According to circumstances, thirst should be present, but there's an abnormal absence of thirst. This is due to the distribution of pathogenic heat affecting the clear and nourishing qi. In such instances, Qing Tang, clear the nutritive decoction, can be employed with Huanglian, coptis, removed for treatment. Thirst is a typical symptom of warm diseases, but the unusual absence of thirst can cause confusion. However, when the tongue appears purplish and dry and the pulse at 2 inches is wiry, large, and forceful, it is distinctly a manifestation of warm diseases. In reality, the invasion of pathogenic heat into the body's nutritive aspects triggers an ascending and steaming action of the vital qi, causing the rong qi, nutritive qi, to ascend. Therefore, thirst might not occur. This should not lead to doubt about it being a warm disease due to the absence of thirst. Qing Tang is used to clear the heat pathogen within the nutritive aspects. The removal of Huanglian is to prevent a further deepening of the pathogenic heat. To be continued.